According to the National Institutes of Health, the American Heart Association, and the CDC, U.S. healthcare costs exceed $2.2 trillion annually. More than 65% of Americans are overweight or obese, and 70% of overweight adults develop preventable yet chronic illnesses such as diabetes, heart disease, and cancer. Businesses, they lose an estimated $61 billion annually due to preventable employee illness. For these reasons and more, Local 103 IBEW's proactive approach to health and wellness continues to evolve.
We first started years ago. We mainly just gave out health and wellness brochures and just told people about preventative screenings. And this year, I think I realized, being a nurse, that it doesn't necessarily work and people want to be interactive. So basically my job is to look through the health claims and figure out where we're having issues, where the disease process is, and then target my wellness programs to what the claims are reading. These men and women pay into the program. They pay a lot of money out of their paycheck every single hour. We need to give them an original plan. And we want to make them healthy, because if they don't maintain their health, then they're not going to work. A lot of the teachers over at the JATC Apprentice School have hopped on board and have actually formed their own weight loss program.
I just left the field to take this instructor's job, so I haven't been lifting the ladders, been moving the stock, and I put on a little weight. So the guys in the office, we all noticed it, because there are 4 full-time instructors now. So we went in and we're helping each other lose weight, and it's a lifestyle change. That 20 minutes on the treadmill every day, 7 days a week, that 20 minutes on the treadmill, whether it's the morning or the afternoon, I feel great.
In my family, they have heart conditions, and I lost both my grandfathers to massive heart attacks. My father had a triple bypass 7 years ago, and it led for me to be on blood pressure medication. And after Caitlin told me, she checked my blood pressure, and my blood pressure was high, even though I was on medication, I knew something was wrong. If I didn't have the resources here to go to ask the questions, to find out, what needs to be done, how do I go about all this, I'd be on my own. I'd be searching through the internet, probably going into useless diet after diet, and the help that I got here, the information I got was valuable.
The Trust Fund Office, in conjunction with new and existing partners in the healthcare field, put on its second annual wellness event and blood drive to again be proactive in its efforts to educate and inform the membership.
I will say 103 is way ahead of the curve when it comes to health and wellness. I have pretty much most of the unions, 85 to 90% of the unions in Massachusetts with me. A lot of them aren't doing things like this, having health field like this, asking for data, running reports, sending postcards to their members about not getting services. They're really involved in this.
We usually check your heart for heart murmurs, any kind of heart problems that you might have in the future or in the past. If you had some damage or coronary disease, I could see it, or in the future we may see something that can cause you to have a stroke, like a hole in your heart or something like that.
We are here to increase awareness of diabetes and the prevalence of diabetes in this country, especially the growing prevalence at epidemic levels. There's about 26 million people in this country with diabetes and another 79 million with pre-diabetes, putting them at risk for developing diabetes. So we're here to increase that awareness and hopefully share some knowledge and information.
And for the second year in a row, a blood drive was held as a part of the health fair.
Last year we donated 170 units 6 days before the Boston Marathon bombing. So we actually helped save victims at the finish line, and we've been using that message.
A message, as it turned out, well received, as nearly 200 units were donated this year. From the blood drive to the vendors, from the staff to the membership, it all boils down to this: overall health of the member contributes to overall health of the plan. Coverage under Local 103's health benefit plan meets requirements of the new individual and employer mandates under the Affordable Care Act. And the fund is operating in the black on a monthly basis as work continues to increase the reserve balance to cover anticipated needs. In 2013 alone, there were $70 million worth of benefits paid on behalf of the more than 14,700 members and dependents. Poor health is directly linked to higher costs and rates of disability and injury, in some cases 2 to 3 times higher. Indirectly, the cost of poor health is perhaps even worse. Medical costs increased 25% from age 40 to 50 and 35% from 50 to 60. But age alone is less of a factor than those who are at higher risk because they smoke, are obese and lack physical activity, or are diabetic. So whether it's getting someone to quit smoking, get on a healthy eating plan combined with an increase in physical activity, or go from being pre-diabetic to not, it all matters. Local 103, IBEW, for the past 100 years and the next.